Hello and welcome everyone. Today we have a very special guest joining us, Dr. Soumya Swaminathan, former chief scientist at the World Health Organization and one of the world's leading experts in infectious diseases. As we witness a fresh surge in COVID-19 cases, we are here to discuss several important points. What the surge means, how prepared we are, and what are the steps that we need to take. Thank you, Dr. Soumya, for joining us today. I will start directly by asking you what is the main reason why we are seeing this fresh surge of COVID cases, and is there any need for us to be in panic mode once again?
So let me first start by saying that there's absolutely no need to panic. Now, why do we have a fresh surge? So COVID or SARS-CoV-2, which is the virus, is another respiratory viruses like the many others that are circulating amongst us human beings in the world today. It's been around now for 5 years. It's of course constantly mutating and changing like other viruses. And just like we get every year, we get a spike of influenza cases at certain seasons. We have also now started seeing that periodically, maybe every 6 to 8 months or so, there is a rise in COVID, circulating COVID cases. In fact, the ICMR database clearly shows that early part of this year, you basically had influenza, different strains of influenza virus as the predominant cause of respiratory infections. Now, after the middle of April or so, and certainly getting into May, COVID, SARS-CoV-2 has become the predominant viral strain in the country that's causing respiratory infections. Now, why is this happening? Possibly because there's a slightly changed variant that's circulating. We now know that, the JN1 variant, which has been around for some time, it's an Omicron type of variant, but there are some mutations in that. People are talking about a slightly different strain now, and it's possible that it's a little more transmissible. And so it's likely that every few months or once a year, we will see this type of thing happening in the future. The good thing is, of course, that we all have immunity now, both from vaccination and from natural infections that many of us have had in the last few years. And so what you're seeing now is a mild disease, mostly. Even though people are testing and reporting positivity, you find that hospitalizations are very few.
Right. What we understand from hospital OPDs and doctors treating these patients, there is obviously there is no need of hospitalization as such. And in ICU, admissions are also very negligible. And doctors tell us that one thing that they have been witnessing most is diarrhea, painless, watery diarrhea that majority of COVID patients are reporting. Doctors say that, if you have a diarrhea, we suspect that it could be COVID and people can opt for COVID testing in this. Ma'am, is there a particular section of people, like we have understood earlier also during COVID, that people with immunocompromised systems or comorbidities need to protect themselves? The advice remains same here as well, despite the fact that we have seen the Omicron wave earlier and this comes from the same lineage.
Correct. So, people who have these underlying illnesses, whether it's immunodeficiency or it is, heart disease or lung disease, pre-existing lung disease, they definitely are likely to get a little more sick when they get a respiratory infection. Again, it is true for influenza. It's also true for COVID. In fact, influenza probably kills a lot more people in India and around the world than COVID. This is not recognized because, again, influenza is something we've had with us for a long, long time, and we treat it very lightly. COVID is still something relatively new, and so we still tend to panic a little bit more about it. But if you really look at the data, probably flu is causing much more illness and much more death. And so it makes a lot of sense for vulnerable people to actually take the flu vaccine, which gets updated every year. The WHO puts out the new strains and companies update their vaccines every year. So
this is a very important point that Dr. Swaminathan has made. Flu kills more people than COVID.
Yes, that's right.
Okay. one major thing that, many people are asking us, and even you would say many experts are also debating on this topic. Do we really need booster shots? Is there a need to update our vaccines now once again?
So if you really look at what vaccines do, COVID vaccines, they prevented us from getting severe disease or dying from the infection. None of the COVID vaccines actually prevented you from getting the infection. So, they were not transmission blocking vaccines. So, so the purpose was served because what we wanted was to save lives and to prevent people from getting sick. The vaccines did that very well. And I think they still continue to actually protect us. I think we still have immunity from those vaccines. Now, should we be updating the vaccines? Now, different countries have got slightly different guidelines on this. In the US, for example, the vaccines are regularly updated with the circulating strains. And very recently, they've changed some of the guidelines, but essentially people could go and get a booster, every 6 months or so. In other countries, boosters are available for people above certain ages or certain vulnerable groups. In India and in other developing countries, it is really a question of, is it cost effective? In the sense that if you're going to give boosters to people, it's obviously going to cost the government a lot of money or cost individuals if they're going to buy it. And what is the efficacy? What is the outcome from that? So this we have to analyze looking at the epidemiological data. So when we see that the illnesses are mild, not requiring even hospitalization, and hardly any deaths have been reported, then you basically reach the conclusion that there is no need for a booster vaccination now, because it's anyway not going to prevent you from getting the infection. To prevent the infection, we've got to do things like wearing a mask and making sure that we wash our hands when we come back from outside. And because it's an airborne infection, improve ventilation in indoor places and so on. Those are the things which can protect against infection. Vaccines protect against severe disease, and I believe we're still protected against severe disease with the immunity that we have. But on the research side, yes, it's a good idea to invest and to have companies at least in a position to be able to update the vaccine very quickly, just in case the next variant turns out to be one that is much more severe. We should be in a position to manufacture the vaccines very quickly. So to that extent, yes, the preparatory activities need to be done, but there doesn't seem to be any reason to start a booster campaign now.
Okay, this is one part of the preparation that you just mentioned. Are there other set of preparatory activities that we should start right now? I'm sure that government post pandemic has been working on creating a strong health infrastructure so that India is ready to face another pandemic. What will be the top 5 things on your mind that we should be ready with in case we face in future, or sooner than that maybe? What are the top 5 things that India should be ready with?
This is a very good question. Let me go back to the report that was commissioned by the Niti Aayog last year. Dr. Vinod Paul, Dr. Renu Swaroop, and myself, and the former NCDC director, we had actually sat down and prepared a report. It took us about a year's work. We had very wide consultations with industry, with pharma, with government, with a lot of players, including civil society. And essentially, we said we need to address 4 buckets of action or activities. The first one is around the law, the legislation, and the governance and the financing for pandemics. We are still governed by the Epidemic Diseases Act of 1897. It's obviously outdated. And therefore, we need a new legislation today that will cover basically all these biological threats like pandemics, which are increasing. We're going to see more in the future, not less. And therefore, we need to be prepared. So the first thing is updating the legislation, or having a new legislation, and then building around that the policies, the governance, and the financing. During COVID, there were these empowered action groups that were set up, groups of very high level, groups of secretaries that actually took all these decisions and so on. So that's something we need to plan for in advance. The second bucket is around data. We have much better improved surveillance now. We have many more labs that are being able to test today. And we also have genomic capacity. that we did not have earlier. However, this needs to be coordinated. Very often we see that the data sits in silos. It's not necessarily shared between departments. The genomic data may be sitting somewhere, but it's not really being used appropriately. We now have wastewater surveillance. Cities like Bangalore have shown that you can actually detect COVID in wastewater weeks before there is a surge in humans. So such things can help you to anticipate and take preparatory action. So there's a whole lot around data and surveillance that which is getting much better than before, but which further needs to be strengthened, coordinated, and that data needs to be made accessible to the public as well. The third set of actions that we need is around R&D. And as I was saying, we need to have the government working with the private sector, identifying a priority set of pathogens which is relevant for India, where we want the private sector to invest in developing vaccines or therapeutics. And so there's a whole list of priority pathogens that's been put out by the WHO. India should have its own list, and then we should have a mechanism for developing, for example, now Nipah virus. ICMR has worked with industry to develop Nipah monoclonal antibodies. This is very important because Nipah is a highly fatal disease. So next time there's a Nipah outbreak, hopefully the monoclonal antibody could be used, even if it's in a research mode. So that kind of support for R&D from government, but involving the private sector, needs to happen. And the fourth is around the risk communication, the engagement of communities, the improvement of health literacy, the creation of public health cadres in every state in India. The National Health Policy of 2017 actually recommended that every state must have a public health cadre, like Tamil Nadu has, but only one or two other states have that. So this is something which is very important, because it's not just epidemics and outbreaks, but a public health cadre is essential to deal with so many risks to health today. So these are the areas where we need to actually have much more discussion, engagement with different stakeholders, and the government will have to take the lead actually in investing in some of these activities. So there is a whole report out there with Niti Aayog that's been presented to the government, and that lays out a roadmap for further action.
Right. Dr. Soumya, let's talk to the audience directly. There is a sense of panic. And when we write stories or when we tell them COVID has now become endemic, that becomes quite a lot cliche, jargonized, and they may not understand it in that scientific manner. So when we tell them that, the waves will keep coming and going, fizzling out, and it's going to be very mild now. So I think coming from you will make a better sense to them. So how do we see COVID now? We have haunting memories from the Delta wave. How do we read the situation as a common man?
So I think the issue is that as soon as you mention the word COVID, some very frightening, terrible memories come back of those early days when we didn't know what was happening, when people were so terrified, and also people did witness a lot of friends and family getting very sick or dying. So those thoughts come back, and I think that's the kind of trauma that one went through, and nobody wants to go through that again. So what I think we need to understand very clearly now, the public needs to understand, is it will not happen that we will have a repeat of 2020 or 2021. At that time, human beings had never seen this virus before. It was a naive population, 8 billion people around the world, a new virus. For it was so easy to spread through that population because we had no immunity. It was only after vaccines were developed, people started getting, so by end of 2021, there was some degree of immune protection. Till then, the virus had a very happy time spreading through the world. Today, the virus cannot spread in the same way because it is met with a strong immune response in human beings. So it struggles. The virus keeps trying to say, okay, what do I do next? Shall I change a little bit? Shall I mutate something? How do I gain entry into the respiratory tract? So it keeps changing, and somehow it is able to come and infect us again by changing itself a little bit, changing the receptors. but still our body has immunity. So it's not able to make us very sick like it was able to do in the early years of the pandemic. So unless there's a big change in the virus again, which I think is very unlikely, we are not going to see a repeat of the early days of the pandemic. So I think we can rest assured. Now, tomorrow, will there be another virus, a completely different coronavirus or a new influenza strain? We are seeing in the US now that we have H5N1 circulating amongst cows. And I think it's much more likely that we'll have a new influenza strain infecting human beings. So we have to be prepared, and government, scientists, researchers are actually in a much better state of preparedness than we were 5 years ago. But for the general public, I think this particular upsurge that we are seeing in COVID, not a cause for concern, but again, I would say let's take sensible precautions. I see people traveling in crowded buses, trains, and planes where they're coughing and sneezing and they're not wearing a mask and they're not covering their nose and mouth when they're coughing. Now, that's just spreading infection to others when you don't need to. So wear a mask if you're coughing or sneezing. And if you're vulnerable or you're a little older or you feel that you have some underlying illness, wear a mask anyway when you're out in a crowded place. That's a sensible precaution. But that's very different from panicking, and taking lots of medicines, or certainly there's no need for any of that.
Right. One thing that people generally ask us or DM us is, "Ab tak to immunity khatam ho hi chuki hogi." So I want to understand the science behind vaccine-generated and natural immunity that we have, that our bodies have against COVID.
So there are two kinds of immunity. One is what we call antibodies or humoral immunity. The other is cell-mediated immunity. Now, the antibodies are much more easier to measure in the blood, but they also tend to decline quickly, let's say in 6 months after the infection. But the cells in the immune system, what we call T cells, they have a memory. We have memory T cells. Once they've seen an infection, they will always remember it. And so the moment you're exposed again to the same virus, the memory T cells say, "I've seen this virus before. Let me stimulate my B cells to start producing antibodies." And within a few days, you will have antibodies back in your blood. So this is why I think that we have still an immune response. Even though you may not be able to measure it in the blood in terms of antibodies, the moment your system sees the virus, it starts actually doing its job, and it does create the responses that we need to protect us. So I think from what we see around us today, the epidemiology of a lot of mild disease and very little severe disease, the conclusion is we still have immunity.
Okay. Dr. Soumya, thank you so much for your time and expertise. As always, staying informed is key to staying safe. Thank you.
Thank you very much.